Good morning, Catherine. Thank you for coming in today. I have a few questions for you.
Okay.
What area or areas of nursing are you interested in and why?
Well, I have a couple. I have my priority is emergency room nursing, and I think I enjoy that most because of the varying complexity of the patients and the fast paced care that we can provide for them. My second would be clinical trials. That's what I do currently, and I enjoy being on that forefront of innovation and being part of the process to bring new products to the healthcare for our patients.
Okay. Tell me a little bit about your clinical experiences. Which rotations did you enjoy the most and why?
I enjoyed my emergency room, my med surge, because it was, again, like I said, very fast paced. I learned something new every time I was there, and my preceptor really kept me in the loop with what was going on, and she really encouraged me to learn what those critical care um, labs were and what they meant. And so I think just the way she included me and allowed me to participate really made it an outstanding experience for me.
Okay, good. What is the biggest mistake you ever made and how was it resolved?
I was working in a long term care facility and I drew up a short acting insulin in an incorrect dosage. And thankfully, it was caught during a double check prior to administration. But that was probably the scariest thing, knowing that I could have given too much insulin to that patient.
Okay. Now tell me about yourself. What do you see as your strengths? Why?
I think my strength is I'm a strong leader because I enjoy helping others. I help others learn and I enjoy that. And so I really always look for opportunities to help them when I can.
Okay, that's very good. Now, how about your weaknesses and why?
I think my weakness is getting attached to patients, and I sometimes allow that to pull me in and take up time that I may not necessarily have. And it kind of puts me behind in the other task that I may need to perform. But I feel that if a patient needs me at that moment, then that's why I'm there, is to take care of them and maybe spend that extra few minutes with them.
Okay. Now, let's see. Tell me about a staff nurse who most impressed you and why.
Brooke was the staff nurse that was my preceptor in the emergency department. And even though she is young, she is a BSN and she is very knowledgeable. She has extreme knowledge of the critical care nursing, and she really tried her best to instill that upon me while I was doing my emergency room rotation. She was the lead for the area that we were in most every time. So not only did she show excellence in nursing, she showed excellence in her management and leadership skills as well. So that left a great impression on me.
Okay, good. Now, how would your most recent nursing instructor describe your performance in the clinical setting?
She would say that I'm a quick learner, I'm independent, and I enjoy learning and taking on new tasks.
Okay. Now, what skills do you feel you have gained from your past work experiences that may help you in this position?
I've been a nurse currently in my position for 17 years, and I've also been a staff nurse over about the last 10 or 12 years. So I think a couple of things. I think the longevity and stability that I've had at my current job gives me the dedication and the loyalty to the job that I need to have. And then I think being a staff nurse has given me the ability to think and act quickly because going into those settings where I may not always be familiar, um, it I have to be very in tune with what's going on at that moment. So I think that um, those two things, just the focus and loyalty, I think will really help me in this position.
Okay. Now, let's go back to about yourself. How would others describe you?
I think others would describe me as friendly and willing to help them in their patient care, willing to help them learn, um, and if and I'm approachable. I think if they need something, I think that they will be willing to come to me and ask me instead of being standoffish and afraid.
Okay. Now let's talk about your career. Any future plans for your career? Where do you expect to be in 2 to 3 years, or maybe even five?
I do plan on continuing my education, and I don't really expect to stop at my BSN. I do expect to excel onto my master's in nursing, but we'll just have to see and take that 1 year at a time.
Okay. Now, we do not have any openings at the present time in the areas in which you have indicated an interest. What would you be able to accept a position in another area, and if so, what other areas are you interested in?
I would be willing to accept a position in another area. In the hospital setting, I have a particular interest for the intensive care unit, or maybe even a post-op nurse position as well. I do like that more critical care component in the hospital setting.
Okay. Now let's go back to your clinical experiences. Tell me about a time when you had to establish priorities during one of your clinical rotations.
During every shift in my emergency room rotation, I had to prioritize care. One particular day, we had 3 patients that arrived at the same time, all assigned to us, and so we had to do quick assessments to assign priority to those patients, and I performed that well.
Okay, very good. Now tell me about a time when you went out of your way to assist a family or patient even though you really did not have time.
We had an 11-year-old that came in, and his parents were in the hall, and he was a critical case, and I saw that the parents were in need of comfort and care, and so at that moment I removed myself because I was only observing what was happening, and I stood by with the parents and comforted them and kind of kept them in tune with what was happening with their son at that time. So in that moment, I could have been observing, but I chose to be with the parents to help comfort them.
Very good. Thank you for coming in for this interview. We'll give you a call soon, okay?
Thank you so much.
Thanks.